Hey guys, today we're going to go over how to get rid of some trigger points using a simple tennis ball, okay? So let's go over firstly a few of the things that we don't want to do with this. So the first thing that we don't want to do is just get onto that area that's tender or sore, right? And just only put a little bit of pressure, or sit there for anywhere from 5 to maybe 15 seconds and just kind of roll around a little bit. It can feel good, and if that's what you want to do, that's completely fine. However, the actual benefit of that is going to be very little to nothing, because you're not getting past the muscle tightness and into the actual fascia. So you have to get past the actual muscle fibers into the fascia, which helps to hold some of the fibers in order to get some actual benefit from using a tennis ball or foam rolling or what have you, okay? So the first thing is you have to be on there for long enough. At least 30 seconds to a minute or longer is best in order for it to actually be beneficial, okay? So that's the first thing that we want to do. The second thing that we want to do is we want to never put this directly like on the spine, for example, if it's your lower back. Probably not a great idea to put it right on a bone where there's not much tissue. That's not going to feel too good, or right into a joint itself, okay? Let's go over what we do want to do. So, for example, if we're gonna roll out maybe our side muscles of our leg, our TFL, we're gonna get onto that area. And what I like to do with this, I don't know if I like it because it doesn't feel very good, but I'm gonna put some pressure. I'm gonna modify how much pressure I use by pushing my hands into the ground. But I typically wanna get quite a bit of pressure on there. So what I'm gonna do is I'm gonna start the tennis ball kind of up this portion, right above the knee. I don't want to go in the joint. We can go above the knee, and we're going to kind of just explore rolling on up. I'm going to roll up and down maybe once or twice, and just kind of find out, make a mental note of where there's sensitivities within that muscle belly. So I start at the top of the knee immediately. There's one there, so we'll come back to that. I go up about 3 inches. There's another one there, about another 2 inches. There's another one there. I'm going all the way up to that femur head or the top of the leg bone. And just before I get there, there's another one. So I got about 4 spots there that definitely need some work. So I'm gonna start, and I'm gonna typically wanna roll from the lower half of the body, or inferior, superior, upwards. And the reason I wanna do that is I wanna try to get my lymphatic system going, get really rid of any of that lactic acid rather than going down the other way, okay? So let's start with that first one, just above the knee. So I'm gonna get onto that spot with that tennis ball. Let me see if I can back up a little bit so you can see a little bit better. So we're right here, taking the ball, putting it right above that joint, right above that knee joint, and then I'm getting quite a bit of pressure on there, and I'm gonna hold that. And that right there is just like misery. That I'm gonna probably start sweating in the next 10 to 15 seconds. I'm putting as much pressure as I can downwards. You know you're doing it right when you start getting really hot, maybe a little nauseous, a little sweaty, a little shaky. You're definitely doing it right. You're getting a lot of pressure onto that spot, okay? Again, we want to hold for 30 seconds, oh gosh, to about maybe a minute or longer, okay? And try to breathe. The worst thing you do is hold your breath like I just did there. You want to continue to breathe as you're doing this. And then I'm just going to explore and roll up. Now you want it like a tube of toothpaste. You want to keep that downward pressure and don't come off if possible. And I'm going to get to that next spot, which is right there. And again, that's just not good. Meaning that it's good. This is a good pain, right? So keep breathing as you're going through this. I'm right on that spot there. I want to hold again for about 30 seconds to a minute. Just keep breathing. Again, this is just like misery. It's so much pain, but afterwards I know it's gonna feel a lot better. So I'm gonna keep kind of breathing through it as best as I can. And then I'm gonna continue on, keep that tube of toothpaste roll, if that makes sense. Keeping the pressure, and I'm gonna roll up to that next spot. Oh, this is probably the worst of the 3 so far. I haven't done this in a little while, so. So just keep breathing. Keep that pressure downwards, and know that when we're done and release it, it's gonna feel so much better, okay? Now, that being said, if you get any like sharp pains, stinging pains, shooting pains, like especially down the leg, get off of that, because you first somehow reason or another you got onto the nerve, that sciatic nerve, and you don't want to do that for sure. And if you have sciatica, do not do this. This is for like muscle aches, cramps, tightness, but definitely not sciatica. I'm gonna go up to the last spot right here. Oh. And even I gotta remember to keep breathing because it's just miserable pain. But again, afterwards it's gonna feel a lot better. Again, holding for that 30 seconds to a minute. Oh. Okay. So simple tennis ball will do the trick. If you want, you can also do like, they have the hard PVC pipe that you can get, that will also work. Or like a baseball will work. The tennis ball, this is like a brand new one. So if you get one that's brand new, it works really well. If you get one that's old and just really soft, it doesn't really work that well. So definitely want to have a harder surface to allow to give some resistance to get that actual relief that you're looking for. So already just, excuse me, I feel just significantly better. It's been pretty tight. I gotta roll the next one out too, which I won't bore you with right now. But try that out, okay? Message me, let me know if you have any questions, but that should hopefully help with that hip pain and lateral leg pain quite a bit. Have a good one, man.